There is no guarantee, and anyone who's been involved in vaccinology will tell you, that we will have a safe and effective vaccine. But we are cautiously optimistic, looking at animal data and the early preliminary data, that we will at least know the extent of efficacy sometime in the winter and early part of next year.
In the United States, daily cases are increasing after an extended decline. We're seeing significant increases in the southeast and southwest regions of this nation. The number of jurisdictions in upward trajectory has continued to increase. Now 29 of 55 jurisdictions fall into this category. The evidence tells us that these cases are driven by many factors, to include increased testing, community transmission, and outbreaks in the settings such as nursing homes and occupational settings. Hospitalizations now are going up in 12 states, and as of this weekend, daily death now has increased in the state of Arizona.
COVID-19 response in our country is still a disaster. 126,000 lives lost was once considered an estimate on the high end of the spectrum. But the year is just halfway over, and it is now a grim reality. And while this public health crisis rages across the country, we've seen the leadership crisis raging in the White House. As the president proves, time after time, he cares less about how this pandemic is impacting families and communities and more about how it makes him look.
Doesn't it sound a little bit silly and a little bit in violation of everything you guys have been talking about? To have people sitting next to each other for 5 or 6 hours in an airplane or crowded into a bus. And my question is, why hasn't, the president issues a lot of executive orders? Why haven't we stopped that type of activity and told the airlines and bus companies that is unhealthy?
Senator, I appreciate your question, and I think it's a critical area. I can tell you that when they announced that the other day, obviously there was substantial disappointment with American Airlines.
Dr. Fauci, every day, virtually every day, we seem to hear from you things we can't do. But when you're asked, can we go back to school, I don't hear much certitude at all. I hear, well, maybe it depends. All of this body of evidence about schools around the world shows there's no surge.
If you were listening, and I think you were, to my opening statement and my response to one of the questions, I feel very strongly we need to do whatever we can to get the children back to school.
If and when, and I feel optimistic that it's when and not if, we get a viable vaccine, we need to encourage folks to choose to get vaccinated. I was really concerned when I saw a recent AP survey that showed that only 49% of American adults plan to get vaccinated.
Of particular concern is it's that proportion of the population that generally are the most vulnerable in the sense of the minority communities, African Americans, Latinx, Native Americans, who in fact, because of underlying conditions, make it more likely that if they do get infected, they would have a poor outcome.
Dr. Fauci, based on what you're seeing now, how many COVID-19 deaths and infections should America expect before this is all over?
I can't make an accurate prediction, but it is going to be very disturbing. I will guarantee you that, because when you have an outbreak in one part of the country, even though in other parts of the country they're doing well, they are vulnerable. I made that point very clearly last week at a press conference. We can't just focus on those areas that are having the surge. It puts the entire country at risk. We are now having 40,000+ new cases a day. I would not be surprised if we go up to 100,000 a day if this does not turn around, and so I am very concerned.